Hi, everyone. I'm here with Dr. Jake Covert. Thanks for being here, Doc.
Thanks, Steve.
All right, so uh, Jake is at Parkway Athletic Club in South Reno. He's got an office in there. If you're in the area and you're looking for chiropractic information, that's where you can find him, Parkway Athletic Club. So, we're going to talk about heat and ice. Now, there's two different, you know, some people do this just for therapy, that like a, a an ice bath, or a cryo machine, which we have one, it's just not there yet. Um, or steam or sauna. That's heat. Those are both good. Back and forth between the two are great. But I think we're talking about today, if you've got an injury, maybe you have a pulled groin or a swollen knee or a twisted ankle or a sore shoulder, or you did something, which is better? Now, I know, being an athlete as a younger person, they never let us put heat on anything the first 48 hours. It was always ice. And now the heat came later. So what do we do, Doc?
So for an acute injury, you're absolutely right. Right after it, if you put heat on something, you're going to get some congestion, too much blood flow to the area, and you can make things worse. Now, in terms,
That's because it's going to inflame or swell, right?
yes, exactly. Yeah, it gets the congestion that you'll get in the area because if once you get too much blood, it's not going to be able to pump that all out. You'll increase the swelling that you have in the area, more pain, longer healing time, essentially. In terms of ice, ice is a very mixed bag right now in terms of is it useful or is it not? They had a study that recently came out where they essentially cut all the ACLs on some mice. And on one group, they applied ice, one group, they applied heat, the other group, they didn't apply anything at all. And essentially, what they found with the ICE group was that in terms of long term healing potential, the scar tissue formation that they had was actually disorganized, so to speak, and it produced more movement limitations down the road because of the initial use of ice. Now, ice is great for numbing the pain, decreasing the swelling, but you have to look at it also kind of in the sense is what is swelling? It's a natural response that your body's producing from something that happened. And so it happens for a reason and it is useful. But if the swelling does get to be too much, you will need to bring it down. But kind of the consensus that I feel that's starting to happen in the shift is limit the amount of ice that you're using initially after an injury unless you have too much swelling. Let this inflammation take its course and then respond thereafter depending on how you're feeling and the symptoms that are arising.
Hey, um, that's the way that kind of the holistic type practitioners are going, is let your body do what it wants to do instead of trying to make it do something else. If it's swollen, okay, let's just kind of let it ride. And that's kind of what you're saying. Now, I find it interesting that I know we're in the, not sure when this is going to happen, moving our cryo machine from one location to the location you're at. And in that case, that's dry, but it goes to negative 230 degrees. Now, that's a lot colder than ice, and you only stay in there for a maximum of 3 minutes. But I can tell you that when people get out of there, they feel like Superman.
Yeah, no, that's great. And bringing it back to your point too of how dry it is, especially because if you can do something like that right after workout on something that's more of a chronic issue, there's a lot more benefits of it. Even when you talk about kind of like the buzzwords that people are saying is like the cold shock proteins or the heat shock proteins, the exposing your body to these extreme values essentially for a short period of time and having your body be able to bring itself back down to normal is so healthy in terms of longevity. And bringing it back to the cryo chamber as well, right after a hard workout, if you could limit some of the muscle soreness and utilizing it's what they call conduction type energy transfer because it's a dry aspect of the cold going onto your skin, and that can be very effective for those short periods of time to feel better the next day.
Right. And so I know something that was really big when I was in college, and that was hot and cold plunge pools. And they kind of faded away in the 90s, in the early to mid 90s. They kind of faded away. But then they're kind of making a comeback now where people are like creating their own little hot and cold, where they'll get in the sauna and then they'll get in a cold shower.
Mhm.
But we're also talking about people that don't have injuries,
Mhm.
right? We're talking about recovery from exercise. What do you think about that? Where maybe you go to the gym and you get in the sauna, or you get in the steam room, and where you are, we have steam and sauna,
Mhm.
and we certainly have cold showers. What do you think of that?
I think it can be very useful. Like I said, if you're not talking about an injury aspect, as everything's about kind of like that vasodilation that you want in terms of working out. And because if you have more blood flow to the area, you're going to increase the amount of oxygen and nutrients coming to the muscle. And doing a cold plunge, sauna, etc., it's going to change your body from its normal standard, causing your body to react and bring it back towards that normal kind of homeostasis that it's normally at. And kind of challenging your body like that and forcing it to respond is very healthy. And just in terms of recovery, like you said, like for the cryo chamber, if you can get into a cryo chamber right after a hard lift, you'll limit some of that metabolic damage maybe that's occurring in the muscles. You'll be able to recover faster, get back into the gym quicker, and then make more progress.
For sure. The faster you can recover, the faster you're going to gain strength, the faster you're going to build muscle, for
Mhm.
sure.
Yeah,
Uh,
definitely, and that's kind of it's a good point too, because like you mentioned the cryo chamber in terms of how dry it is, and I know at Parkway we also have a wet sauna, which very interesting on that as well, because that heat energy transfer is essentially called convection, where it's a wet going onto your skin, which in terms of energy transfer, there's more potential for the energy, so it's going to be greater energy transfer, greater effect, and ultimately you'll need to be in there for less amount of time. And I've seen a lot of people have a lot of good benefits from the wet sauna here at the gym as well.
that's a steam room, right?
Yes.
Okay, I'm going, yeah. Don't don't put water on the rocks in the sauna.
Yeah.
Um, so yeah, the difference is the steam room is steam. It's moist and
Mhm.
it's hot.
Mhm.
The dry sauna is dry, just like the cryo machine is very dry. Because I mean, you couldn't get in anything that was wet that was negative 230 degrees. I mean, you'd be a popsicle. You'd need a chisel to get you out.
Yeah.
Any last thoughts on, really hit us with what is best? Is there an answer? Heat or cold?
I think it depends on the person, kind of like you said. In terms of injury, like we talked about, I think letting the injury ride, but also listening to the response of your body is going to be the most important thing initially. But if it's a kind of a chronic and you're focusing on more so of optimization of your workouts and recovery process, it's really going to be your preference at that point. And utilizing a cryotherapy to limit muscle soreness, or utilizing the heat to get more vasodilation to the muscles, increasing oxygen and nutrient flow is going to be the best case scenario. So really, it comes down to preference, I think, for recovery and performance.
Yeah, and at some point we also have spas. The hot water jacuzzis are one type. Eventually, that's okay after an injury, right? Getting the jacuzzi, that's going to have a positive therapeutic reaction for your workout.
100%, and I utilize that for some patients as well, because going back to that kind of convection type, is you getting into a sauna. 20 minutes is kind of the maximum vasodilation point that they'll say, and I'll have some patients that'll get in the sauna, they'll dry off, and then they come and see me, and all their muscles, there's a lot of blood flowing, muscles are looser, they're more relaxed, and you can get a better workout and a better treatment in.
All right, so there you go, everybody. Um, Heat and cold are both effective. The timing's got to be right. So, Dr. Jake Covert, if people want to get a hold of you, find out more about what you're doing, how do they do that?
They can find me at Instagram at atlaschiropractic.us or my website, www.atlaschiropractic.us, or call or text me at 775-848-0540.
All right. Thanks for being with us, Jake.
Thank you.